This is the makeshift isolation ward at the Western Regional Hospital, where COVID-19 patient number 4, Hubert Pipersburgh, was admitted on March 31st. According to a Facebook post by his wife, Maria Estela Recinos, she believes her husband was put there because no one was willing to attend him. She claims it didn't even have a bathroom. Pipersburgh had started with a sore throat and dry cough on March 21st, and endured almost a week's worth of highs and lows with those symptoms. 5 days later, more serious symptoms appeared, including fevers that went as high as 103 degrees, pain, and trouble breathing. On March 27th, 6 days after his first symptoms, Pipersburgh's wife called Dr. Manzanero, presumably DHS Marvin Manzanero, to request a test. She says that after a series of questions, they were told that Pipersburgh did not qualify to have tests done. Another 3 days passed by, and the couple sought second opinions at La Loma Luz and a local clinic. No health professional they'd seen believed the symptoms were linked to coronavirus. They medicated him for fever and respiratory issues, and Pipersburgh went home. Last Tuesday, they headed back to Godoy's clinic for more tests. But Maria Estela says Pipersburgh struggled to make it from the car into the clinic. At the time, she thought he was having a heart attack. That's when he was referred to the Western Regional on Tuesday, March 31st, to get a chest x-ray. Unbeknownst to the couple, Pipersburgh had developed pneumonia. He was swabbed on the night he arrived in Belmopan, Tuesday, March 31st. And in the early morning of April 3rd, Pipersburgh received a positive coronavirus diagnosis. 16 hours later, he had to be moved to the KHMH's COVID isolation unit with acute respiratory issues. Shortly before his arrival, his doctors photographed in heroic stances and a statement from the KHMH describing the months of preparation that had led to the admittance of the man who became the COVID-19 unit's first critical care patient. He would also become its first casualty. He was placed on a ventilator in an induced coma from which he never awoke. 55-year-old Hubert Pipersburgh died on Sunday, April 5th. His wife and children are left to mourn and wonder if his life could have been saved by more decisive actions on the part of his healthcare providers and the government of Belize. In her post, Recinos asks, what if Dr. Manzanero had conceded for a test to be done on him on Friday the 27th? Maybe he would have received treatment and would be safe. How could he make such a decision when someone has the majority of the symptoms? She concludes with alarm, quote, Western Regional is not ready to handle any incoming patients. Their staff is not ready. Charisse Halsall, 7 News.